Welcome to the healthcare facility ahead of its time,
where resilient infrastructure, reliable power, and digital innovation converge to deliver safe, comfortable, and empowered experiences for all. A place optimized by technology and prepared to adapt for you, your loved ones, and your community to count on for years to come. As specialists in digital transformation, building automation, and smart energy management, we support your journey to the all-digital, all-electric healthcare campus. Together, we can protect people and infrastructure with dynamic power management and secure systems, empower patients and enable autonomy with integrated digital solutions, support staff and streamline workflows with interoperable clinical and facility systems, transform maintenance programs with connected technology and advanced analytics, and progress your decarbonization journey with consultancy services, lifecycle software, and electrical infrastructure solutions from roadmap to realization. Schneider Electric is your trusted technology partner to design, build, optimize, and transform smart healthcare facilities ready for today and flexible for tomorrow. EcoStructure for healthcare, enabling the healthcare facility ahead of its time.
Hello, and welcome to Schneider Electric's Healthcare Innovation Talk series. My name is Briley Shaw, and on behalf of Schneider Electric's Global Healthcare Leadership Team, I'm honored to have you join our discussion on digitalization and the healthcare transformation. Today, I'm standing in our Innovation Executive Briefing Center in St. Louis, Missouri, one of 3 healthcare innovation hubs located across the globe. With more than 10,000 square feet of R&D space, this one-of-a-kind facility is where our world-class digital innovations come to life. Today, we officially launch our 2-part Healthcare Innovation Talk series, and with a focus on digitalization, our St. Louis facility is the perfect place to host Part 1. During today's event, we'll travel across the globe to leading healthcare organizations and behind the scenes to our innovation labs right here in St. Louis. Throughout our journey, you'll hear and see how healthcare leaders and solution specialists are utilizing technology to transform facility operations and delivery of care. Remember, this innovation talk is interactive. Please post your questions and comments in the chat, and we'll come back to you in our live Q&A before we close out the event. And with that, let's begin. At Schneider Electric, we actively invest in talent, innovation, and a world-class ecosystem of partners to reach more than 6,500 healthcare customers in over 50 countries across the globe. Despite their distance and their differences, the challenges our customers face are remarkably consistent and tend to fit into 5 categories: insufficient infrastructure, workforce challenges, evolving patient expectations, increasing cost pressures, and of course, decarbonization acceleration. On the front lines, this looks like modernizing or expanding an estate, adopting new technologies, managing maintenance backlogs, keeping up with compliance requirements, and so much more. It's a head-spinning agenda for any healthcare facility leader and the status quo for most. The fact is, healthcare leaders are facing a growing list of challenges and less resources to solve them. The good news, many are digitalizing to adapt. Let's take a quick trip across the globe to hear how 3 healthcare leaders are taking action. Our first stop takes us to New Delhi, India, where Dr. Karen Thakur, Group Lead of Sustainability and ESG and Vice President of Projects and Public Affairs for the Apollo's Hospital Group, addresses the relationship between digitalization and decarbonization acceleration.
In healthcare, sustainability has become a buzzword now, and we are very happy that it has become so. We were the first organization way back in 2019, pre-COVID, to put together a team on sustainability because we realized that is an important pillar in healthcare. Right. With quality, affordability, access, sustainability needs to be important. Now, sustainability is also financial sustainability, but more than that, it is your ecological footprint that you need to look at to green your facilities, to bring in more and more digitization so that you can reduce your resource consumption. Waste, water, energy consumption is massive in hospitals. And how do we become more ethically tuned towards that? So that was the drive that one had. Now, if you look at where sustainability has reached today, it needs multiple focus points. Whether it is on the patient care side, how can we reduce the waste that is being generated, the water that is being generated, water that is used, how can that be reused, buildings, how can they have building management systems where energy is efficiently used, resources are efficiently allocated. For us, we look at it through the 3C's lens. So it is not just about care effectiveness. That is primary. Everything we do is for the patient. But also important is cost effectiveness, because any new technology that we add on has to be cost effective, because ultimately the patient pays for it, or you have to accrue your own resources to pay for that technology. But third, now we've added is carbon effectiveness also. So all three have to be put into place, and I'm very happy to state that we are amongst the first organizations which looks at all three of these C's before making a big decision on capital or on new technologies to be brought in. So for us, it is marrying all three. But yes, if I had to choose one, our patient care, that care effectiveness still remains on top, but carbon is equally important.
As Dr. Karen Thacker points out, embracing digitalization is a requirement of decarbonization. And as we'll see in our next clip, it's essential for efficiency too. Bert Gummeringer, Senior Vice President of Facility Operations and Supply Chain Management at Texas Children's Hospital, oversees 10 million square feet of space, 953 patient beds, and 1,100 full-time employees. In this next clip, Bert addresses the potential impact of digitalization and specifically artificial intelligence on facility operations.
I think that will have tremendous impact, and I think it's going to impact us from the standpoint of we'll be able to make decisions quicker, with better information, which I think is key. And I think over the next couple of years, I don't want to say it's going to revolutionize the facility operations piece, but it's certainly going to move us forward to a much different vein than we are today. And I think if we don't do this, we will be left behind. Because there is so much going on in the digital world right now that for me, digitalization, and AI are the way forward. It's the future.
Digitalization is the way forward for Texas Children's, and as we'll see in our final clip, for Maine General Health, a 640,000 square foot facility located in Augusta, Maine. In this next clip, Rick Albert, Director of Engineering and Plant Operations, discusses how digitalization drives energy efficiency across Maine General's 192-bed facility.
The challenge of energy for us is significant. When electricity goes up, it's obviously painful. When natural gas prices go up, it's very painful. And our challenge there, aside from buying the commodities, is to try to make our buildings as efficient as possible, because at some point you can't squeeze any more out of those commodities. And now you're looking at all your systems. Now, fortunately for us in this new building, our systems are new and functioning very efficiently, not so much in our older buildings. So I suspect over the next 5 or 10 years, we'll see upgrades in control systems. Like in here, for example, in our cooling systems, we have variable frequency drives everywhere. That's not the case in some of our older buildings. Some of our older buildings have air systems that are 30 years old, right? So they are obviously not the most efficient. So I would say that that's one of our big challenges is to become more efficient in how we consume all those commodities.
The collective feedback from the front lines: digitalization is an essential strategy for healthcare organizations. As the driving force behind Schneider Electric's technology roadmap and the value we deliver to our customers, we couldn't agree more. At Schneider Electric, we enable the healthcare facility ahead of its time. We partner with healthcare organizations to design and deliver digital solutions that are ready for today and flexible for tomorrow. Our interoperable solutions enable lifecycle digitalization and end-to-end electrification. With our global network of specialized consultants and solution leaders, we help our customers harness the power of digitalization and electrification to achieve resilient, care-centric, efficient, and sustainable healthcare facility operations. In this next segment, Daniel Garcia, our Global Healthcare Segment Solutions Leader, expands on digital solutions for the healthcare facility ahead of its time.
Thank you very much, Briley. Welcome to the Solutions section of this event. My name is Daniel Garcia, and I'm the Healthcare Solutions Team Leader at Schneider Electric. My role involves the definition of solution development priorities across all our business areas, among other technology-related activities. My background is in healthcare IT and system integration, and I have worked integrating technology into healthcare projects in Australia and Europe for the past 15 years. Today, I'm going to share 3 ways that technology, and in particular digitalization, can transform healthcare facilities across the entire life cycle, and how this addresses some of the challenges our healthcare customers share today. Before we begin, let's define what we mean by building life cycle. Here, we refer to each stage involved in designing, building, and operating a healthcare facility. It is important to highlight these 3 phases, as when we talk about healthcare projects, we sometimes tend to focus on a specific phase depending on our scope in the projects as owners, consultants, builders, technology providers, or facility managers. Firstly, the design phase can involve the design of a brand new hospital or the redesign of existing facilities that are undergoing renovations. During this design phase, it is crucial for design firms, end users, and technology partners to engage early, as during this phase, the scope and purpose of digital solutions must be clearly defined to ensure the feasibility of the implementation during the build and operational phases. Why is this? Digital tools can be inexpensive to deploy when that deployment is planned and kicked off during the early stages of the building life cycle, but its implementation can be costly and potentially unsuccessful when tackled when the facility is in operation. A good example of digitalization during the design phase is the use of digital twin tools to facilitate intelligent planning and an efficient project handover. For instance, the use of an electrical design digital tool, such as Schneider Electric Tab, will help design teams streamline and de-risk the electrical design stage while providing live simulations and access to digital documentation during the whole building life cycle. Following the design phase, the build phase refers to the construction phases of both base building and fit-out. During this phase, with a significant number of stakeholders involved, digitalization can become the cornerstone for collaboration across design and engineering disciplines, using software to support design decisions via simulating different project scenarios. Our construction project management digital platform, RIBM2, is a good example of a digital platform that can help stakeholders consolidate all design tools and documentation, as well as track the CO2 footprint across all construction phases and disciplines. Finally, the operational phase involves the day-to-day activities and functions to deliver patient care, manage building and clinical resources, and ensure facility infrastructure is properly maintained and in compliance with regulations. During this phase, digitalization will provide access to data across all key building systems to make informed decisions for asset, energy, space, and resource management, allowing previously disparate systems to be unified. Additionally, digitalization will be the key to the transition from a reactive operational model to a condition-based and proactive approach. Our EcoStruxure Advisor platforms are a good example of this, enabling an asset health and condition-based approach to asset management. So following up from the insights provided by our customers, we will focus today's session on 3 digital solutions: electrification and digitalization, data-driven asset management, and integrated building operation. For the first of them, electrification and digitalization, we have seen that one of the key challenges from our customers is the need to decarbonize the operations to achieve their own net zero targets while adhering and preparing for sustainability regulations. A core strategy to achieve this is electrification, which represents the key pillar to the shift to a net zero emission system together with cleaning the electricity supply. Apart from electrification, digitalization appears as the second pillar to tackle the decarbonization challenge. During the design phase, digitalization can support an intelligent master planning and design approach supported by digital twin tools, as we mentioned before. Through the use of a TAP, our electrical design digital twin, project teams can simulate electrification scenarios, analyze outcomes such as energy production or consumption, as well as understand infrastructure constraints in real time. This real-time simulation feature will help understand and prepare to tackle a key electrification challenge. Is the grid capable of keeping up with electrification? One strategy to overcome the grid capacity challenge consists of integrated on-site energy sources like solar photovoltaic technology, battery energy storage systems, cogeneration plants, wind power, or even the use of clean emergency backup power plants during normal business operations. Digital tools, such as our Microgrid Advisor platform, support this strategy by enabling the automatic monitoring, control, and predictive optimization of those distributed energy sources, integrating analytics-capable equipment and connecting to our smart energy management software. A great example of this is a National Health System Trust in the UK that is on its electrification journey, involving electrifying its existing estate, building a new all-electric hospital, and integrating the two of them. In this project, we are providing technology advisory services to streamline the electrification journey, supported by the use of a TAP to simulate different electrification scenarios and technology choices. The second key challenge our customers most frequently mention is related to the need for operational continuity and infrastructure reliability, challenged by limited resources such as operating budgets and facility staff, as my colleague Briley mentioned before. As such, hospitals require solutions that ensure critical assets operating efficiently and with 24/7 uptime. To address this, healthcare facilities teams need a realistic way to migrate from reactive and spreadsheet-based asset management strategies to a data-driven and condition-based maintenance approach, with real-time insights into the operating conditions of equipment. Under this model, asset maintenance takes place only when it is required based on asset health, actual wear and tear, and operational efficiency, maximizing the lifespan while minimizing the whole-of-life cost of ownership. A reliable data-driven asset maintenance strategy depends on the availability of connectable assets across all critical infrastructure, such as our electrical and data center equipment, as well as AI-enabled digital platforms to track the health and real-time condition of those assets. Our EcoStruxure Advisor and Plan-on tools are good examples of digital tools that can enable a data-driven asset maintenance model, providing insights on asset operation, asset health, expected asset end-of-life date, as well as other operational insights, such as asset fault detection and automatic asset operation optimization. A real-life example of the value of implementing this type of strategy is the Chute de Lille University Hospital project in France, where the implementation of a data-driven asset management strategy is leading to a predicted 15% reduction of energy consumption and the delivery of 100% system uptime. Finally, the last challenge from our customers that we will address today relates to the need to integrate key hospital systems to boost operational efficiency across clinical and facility teams and systems, while enhancing patient experience. We have seen before how healthcare facilities are currently facing operational constraints in the shape of clinical staff shortages and burnt out, which results in the need for a more efficient use of clinicians' time to focus on patient care. As we discussed just before, these inefficiencies also affect facility teams who normally handle long backlogs and struggle with the prioritization and scheduling of maintenance tasks. The integration of key facility and clinical systems such as HVAC monitoring and control, lighting control, nurse call systems, or real-time location systems under the same platform can help mitigate these operational inefficiencies by digitalizing operational workflows, automating the hospital's operations to delegate non-clinical work to digital platforms. To tackle these challenges, we can support our customers by providing digital solutions to enable integrated building operations, by integrating our BM building management system, EcoStruxure Building Operation, which most of those facility and clinical systems to automate workflows and reduce clinician and facility teams' clerical work. These integrations enable an automated schedule of maintenance tasks by synchronizing them with the clinical schedules and reduce care disruption, which ultimately leads to reduced clinical fatigue and burnout. We can also support healthcare facilities by delivering consolidated patient room control and monitoring capabilities to provide a harmonized experience where the patients gain control of their environment and privacy using our EcoStruxure Connected Room Solution platform. A good example of a fully integrated building operation platform is our project in a 250-bed acute care private hospital in Australia, where we deployed a fully integrated data platform across key facility systems, resulting in a 33% reduction in patient complaints and a reduction to up to 29% in scheduled maintenance. Well, this puts an end to the solution section of today's session. My colleague Mike Sanders will now discuss the features and benefits of the application of this integrated design philosophy to tackle another key challenge in healthcare facilities: patient experience and satisfaction. Over to you, Mike.
All right, thank you, Daniel, and hello, everyone. Welcome to the Integrated Healthcare Experience at the Innovation Executive Briefing Center in St. Louis. Today, what we're going to do is we're going to show you exactly how the Integrated Healthcare Control Platform works and give you a real look at the benefits that all the patients derive from this. Now, we start in a lot of different areas here. We have so many different zones within the hospital that we demonstrate here. And it starts really here in the admissions area, where we basically talk about tying the electronic medical record to the patient and giving them the opportunity to have an RTLS tag, which is a locator where we always know where the patients are in the hospital. In our doctor's office, we talk about the experience that we have of being connected to imaging, radiology, to laboratories and pharmaceuticals, to even occupational and physical therapists. These are areas where the doctor's office needs to be connected so that the patient has access to their own medical record and the doctors can fill in everything they need to know about their care, but also even as far as connecting them with patients on a virtual basis, because we now see that a lot of doctor's visits are virtual. Some of the other areas of connection that we work with are in the MRI area, where we would have a UPS that would clean the power and be able to back up a system in case of a power outage. Our operating theater, which would be isolated from the rest of the power system within the hospital. So if there is an outage, we don't lose power in the operating theater. All of these are working to serve the patient. And we are using the integrated healthcare platform to deliver information to the caregivers that will work with each patient. One of those ways we deliver information is through the patient door sign. These door signs that we have all over the building within the patient, outside the patient room, will give the caregivers opportunities to know exactly what they need to know about everything about the patient inside before they walk into the room. And so we're giving the nurses and doctors the opportunity to have real-time information that's always updated that they can utilize as they walk into the room for patients, which really kind of cuts down the research time that they need to have prior to going to see a patient. But where the heart of care happens is in the smart patient room. Now, one of the things we found is patient satisfaction is impacted by their experience in the hospital. And if you think about it, their role, their whole mindset has to change when they come in the hospital. They lose all control whether or not they can sleep, whether they can get up and walk around, what they can eat and when. So this is something that they've lost a lot of control over. So we want to do everything that we can to help that patient who is already unwell feel better about their environment. So we give them control of the room by giving them control of the temperature, by letting them just operate freely within the room and manage some of the different artifacts around the room that they can work with. Like, for example, the window shade, to be able to open up the windows and handle those. And regardless of how we control the room, whether it's switches, whether it's a bring your own device, whether it's using the pillow speaker that we have in each of the rooms, the number one way that everybody wants to control the room, whether they're 6 or 96, is via voice. Alexa, shade open. What ends up happening is that by giving them the opportunity to control the room, the temperature, the lighting, the television, calling the nurse, giving them the opportunity to do that via voice gives them just a comfort level and a peace of mind that they are able to do whatever they need to do without having to scramble for a device or grab the pillow speaker. They can just call out for what they want to have happen. Now, one of the things we've noticed also is that the staff productivity is impacted by a number of factors, and they don't get an opportunity to share as much time with the patients individually as they might, because they may be talking to visitors and trying to help them understand patient care. They may be doing other administrative tasks, which we're trying to alleviate with a lot of this integrated healthcare platform. One thing we can do as far as visitors go and even information for the patient go is to give them information that is commonly asked of each nurse every day. Alexa, combo mode. By putting the whole base of information about the individual patient on the information footwall, we can cut down a lot of that time that the nurse will be spending answering questions, and give them the opportunity to care for the patient directly. So as you can see here on the board, we've got the doctors and nurses that will be attending to the patient, what their goals are for the day, if they have any kind of appointments or consults that they're going to, and then some other things about their care, like when they last had pain medication or whether or not they can eat and walk around. All of these items are typically questions that they're asked. And so what that does is that frees them up, and it provides this information on demand for the patient. And then when they want to go back to full screen, it's very simple for them to do. Now, one of the other things that happens in a hospital is people will walk into rooms and you have no idea who they are when they're in your room. They're coming to draw blood. They may be someone coming in to change a light bulb or do something else, maintenance in the room. And that kind of sets the patient off a little bit because they don't know who's in the room. So using the RTLS system, which also handles staff and knows where all the staff is, when they walk in the room, they could have an indication of who's in the room. So if a maintenance person walks into the room to change a light bulb, their picture would pop up on the television and say, "This is Dave, he's here to change a light bulb." This could also give the patient a heads up that the visitor is approaching. And so they would know that they could get themselves ready or whatever, prepare themselves for a visit. All of these things add to that patient satisfaction level. Now, some of these things may seem kind of soft or not really make a hospital, especially with the cost pressures they're facing, why would they invest in this? Well, let's talk about how this all works. So when you were admitted to the hospital, it may have been a couple of hours ago, but you went to a doctor, you may have got some blood drawn and everything. As soon as you checked in, though, you were assigned this room. Once you're assigned this room, we have the opportunity now to prepare the room for you. But while you're out of it, we don't want any energy being expended in here at all. So the window shades are closed, the lights are off, the TV's off, there's no air exchanges happening. Nothing is going on in this room that would use energy. It would be a zero energy use state. We know where you are because of the RTLS. The real-time location service is watching you everywhere you go in the hospital. And when you get 25 or 30 feet from the room springs to life and the window shades come open, the TV comes on, the lights come on, and the temperature's set and air exchange is performed. Everything is set for you. So when you walk in the room is completely prepared. We dynamically manage the energy of each room. Now, doesn't seem like a big deal when you've only got one room, but in Penn Med, which is one of our flagship users of the system, they're managing 504 beds. That is a lot of rooms to do dynamic management of energy usage. So when you think about it, not only does it save money because of the energy conservation, but it's also very sustainable. All of these elements here come together to bring those 5 trends that Daniel talked about to life. One of the other things we want to do is we want to be able to deliver patient care by using the integrated healthcare control platform and actually use the building. So if we have an element where the patient has an urgent need, like a code blue, which is a very, very urgent need, you'll see that the system goes off, the patient goes into distress. The teams outside this room were scrambling to get somebody in here to help out. Now, as soon as they come in the room, in a non-connected room, the nurse that would come in here, he or she would have to come over and hit this cancel button to alert the team that somebody's taking care of the problem, but also to record the response time. In an RTLS-enabled room, as soon as that nurse would walk into the room, he or she would be recognized, the alarm would be canceled, and the nurse would not have to make the decision between the button and the bed. The crash cart may be 3 doors down, and an orderly may be dispatched to bring it to the room, or in the days of Roomba, maybe it's driving itself here. And the cardiac doctor, who's 3 floors away, gets a page on his smartwatch and walks out to the nearest elevator, which is standing open and will not move until his badge walks on there. That's using the building to deliver care to the patient. It's been documented to save a lot of time in terms of staff movement and getting them to attend to the issues. Now, those are just a couple of use cases that we have here. And we have about 120 different use cases that we've got documented and quantified as far as how they save the hospital and what they can do. All of these elements combined together in the integrated healthcare platform to give us an opportunity to deliver care in a patient which meets all of those needs, because we're constantly managing the infrastructure. We're doing the best to maximize staff productivity. We're giving the patient satisfaction. And we are addressing other needs throughout these, which will give us the opportunity now to deliver exceedingly superior patient care to everyone who comes through this. By tying all these elements together, now we are providing opportunities for financial management of the hospital and for patients to enjoy all of the integration and the smart patient care that we've delivered. I hope this kind of gives you an overview of how the system works. And what I'd like to do now is send it back to Daniel and Briley for questions.
Thank you, Mike, for that fantastic presentation. As you may have gleaned from his lab tour, integrated digital solutions are essential to achieving resilient, care-centric, efficient, and sustainable healthcare facility operations. We've officially arrived at the live Q&A portion of the event. Mike is currently hustling down from the healthcare lab to join us here, but as we wait for him to arrive, we'll go ahead and kick it off with our first questions. Dan, one of the questions in the chat is around emerging trends and technology advancements. What trends do you see shaping the future of digitalization, and what do you think the impact will be on healthcare delivery and facilities management?
Oh, very good question. So we see a lot of trends, particularly on digitalization. I guess if we could summarize the three key ones that we've seen, the first one I think is the use of digital twins as design tools. So we see that they implement electrical, for example, in our case, electrical digital twin on the early design phases to simulate different scenarios. So that's changing a bit the way we design and operate facilities. So now we can have a view on the future of the operation while we're designing the facility. So that would be one of the key trends, having that visibility on the future of what's going to happen with our infrastructure. The second one, as I mentioned before, is the transition from using spreadsheets to run maintenance to use data-driven models. So what we're doing is asking the assets themselves, how are you going? Are you in good health? What is your condition? And we use that to feed the asset management tools, which means we have a real-time visibility of what's happening in the asset. So that's changing a bit how facility teams are spending their time. So instead of doing reactive, they move into proactive. I guess the last of the trends could be that having that visibility also on the whole life cycle of the building, from design to build to operate, to have that sustainability view on everything and having that flexibility on how we operate those facilities.
Mm-hmm. Great, thank you. And I think what we have to acknowledge is that we can't predict what technology will arrive in the future. And so what's really important is that we have a platform in place that's open, that supports integration, and that can adapt to the technologies that do come forward in the future that we can't possibly imagine in this moment. With that, I would like to welcome Mike Sanders back to the show here. So we'd like to ask you a question about the healthcare lab. Okay. There's a lot of interest in the chat amongst our customers about that space. Mm-hmm. I wonder if you could explain a bit more about how we use that space with customers today and how our audience members can get in on some of that action.
Well, as you probably saw, we just barely scratched the surface of what we're capable of doing in that healthcare lab. And I think the beautiful thing about that is it really gives us the art of the possible. What it does for customers is when they see that, when they get a little tangible example of what's capable there, it really starts to spark discussion. And what else can we do? How else can we expand it? What do we do that is really unique to the customers, to the patients, and how can we further deliver care? What new things can we introduce into that? So that's the really nice thing about it. Now, as far as how to get involved, well, all you have to do is call us here, or call your Schneider Electric sales rep, or whoever you contact with us, to set up a demo with us, to be able to have a very in-depth demo of that. Because what that does is that gives us the capability of showing you everything in depth and customizing that experience for you. So if there's specific elements that you want to see that we can do within the healthcare, we can do that. But it's certainly a great opportunity for us to bring that to you, either virtually or live if you come to the building here in St. Louis.
Great. Thank you, Mike. I love how you frame that, the art of what's possible. It's really relevant to, I think, all aspects of technology and healthcare, and I want to use that to transition us to AI. There's certainly a lot of interest around artificial intelligence and what it means, what it might mean in the future. And Dan, one of the questions we have in the chat is, how do we approach security with AI as it relates to patient data and so on?
Yeah, I'm glad we have that question, because that's possibly another one of the big trends that we see in digitalization. Is everybody's talking about AI, what's going to be the impact on AI in healthcare management and clinical team operations. I think data privacy and data cybersecurity is not something that is come just now with AI. It's something that's been there for a bit. I guess the right answer is, in healthcare and in any other scope, what we normally do with this type of data is anonymizing it. So any algorithm that's running to learn on the operation, on the behavior of patients, would be anonymized. So the key information of the patient will never be in those algorithms. So ideally, using that type of paradigm and model, even a leak, even if you were attacked and you had a leak on your data, that specific data would never be released to the public.
Okay. And I'd like to stay on the topic of security, as it's a primary concern for the healthcare sector worldwide, and go back to that topic within the context of the healthcare lab. Of course, we have that really fun Alexa feature in the patient room that everybody loves, but it does raise an interesting question around patient data, privacy, security.
Sure.
So could you help us understand how we manage that?
Well, first of all, that implementation was one that we did a while back, and so Alexa was the keyword for that, because that was just a normal keyword that everybody had used. But it doesn't imply that we're going through Amazon or Google or anything for that. It's actually homegrown. The system now actually is triggered by a completely different keyword, not Alexa, and that we actually call it Hey Iris. So that's one that is a little bit different. So I do have to explain that to folks and everything, because we implemented that a long time ago. I think one of the things, and going back to the AI piece of that, is the really nice thing about AI is it gives us an opportunity to address things like patient occupancy, footfall, and how many people are in the room, what the traffic is like in there. And as we learn on those areas there, we're able to apply more and more against that. So cybersecurity is a big part of that. Of course, the Alexa format to call the system and actually promote system command is not really Alexa, like you say. So don't worry, don't fret about that. It's not really that part. So.
Okay, thank you. Another great question coming in is just around digitalization in general. And of course, with the introduction of more technology and automation, there's a sense that maybe the patient experience will be affected and there'll be less interaction with patients. How do we achieve balance? What is the benefit of digitalization to the care provider and care delivery? Is there any risk?
I think we have to we have to see it as the opposite, actually. So the point of digitalization is to remove clerical work and administrative work from both facility and clinical teams, so they can spend more time with the patients. And the feedback we receive from clinicians is exactly that. I became a clinician because I like to help and spend time with my patients. So by digitalizing some workflows, we can streamline some of that back work, some of that taking notes, and then they can spend more time on the bedside, spending time with the patient. So I think it's the actual opposite. The whole purpose of digitalization is to enhance patient experience.
And remember, the implementation of this has been designed step by step from the beginning with those caregivers from that individual hospital against their own procedures, the way that they do things, and all the wish list items that they've had over the course of time. I wish we could spend time doing this. I wish we had time to do that. That's what the integration is designed to solve. By, if you think about the visitor experience, by providing that information on the footwall, that prevents the nurse from having to answer those questions for that visitor. She does not want to get to know them, but she really wants to spend time with them, getting to know them personally, not answering a bunch of questions that he or she answers over and over and over again every day. The workflow piece of that, getting them to the right area, making sure that they have all the information they need without having them to sit at a desk and study up that before they go in the patient. All those different things are designed to free up, as Daniel says, the administrative tasks, so the real heart of care, the real care-centric part of face-to-face nurse, doctor, staff member with that patient is maximized by taking all those other pieces away.
That's a great point. And I regret to say that we are actually arriving at the final minutes of our Q&A session already. So thank you so much to our audience for your questions and your engagement. If we didn't get to your question, we will come back to you. We'll be sure to answer all of the questions and follow up, so do rest assured knowing that. Before I go, I also just want to say thank you so very much for choosing to spend your morning or afternoon with us here today. It's been an honor and a pleasure to work with my colleagues here to discuss digitalization and the healthcare transformation and help demonstrate how Schneider Electric enables a healthcare facility ahead of its time. So if you've enjoyed this session as much as I have, I'll leave you with two opportunities to learn more. So the first is to go ahead and scan the QR code, which will empower you to pre-register for our second event in this Innovation Talk series. The event is scheduled for Q3. We don't have an exact date yet, but as soon as we do, you'll be the first to know about it. So if you're interested, please go ahead and schedule that QR code. And then secondly, we've talked about a lot of digital solutions today, and we've only just started to scratch the surface, as Mike pointed out. So to learn more right away, the second QR code you'll see is an opportunity to download our solutions brochure on digitalization and electrification. It's a brand new piece of material. It's not been released yet. If you're on this call, you are the very first to receive it. You're getting pre-release access. It won't hit the masses until next week or so. So please go ahead and take advantage of that document. And with that, I say thank you very much to both our audience and my co-panelists. It's been a pleasure, and we wish you a wonderful day.